Hospital facing multiple lawsuits following an outbreak of illnesses among surgery patients. Most of the patients were breast cancer survivors undergoing breast reconstruction. Countdown 2 investigator Rebecca Collett started digging into Department of Health records after receiving a tip about the sickened patients last week. And she joins us now with details on the lawsuits filed against Roper today.
The patients who fell ill after surgery at Roper required repeat surgeries and months of antibiotics. And suits filed today on behalf of some of the patients. Attorneys requested a jury trial, calling the hospital grossly negligent.
This complaint filed essentially makes the case the hospital paid hefty bonuses to executives instead of investing money into the outdated water system infrastructure. The attorneys representing a handful of patients claim patients were sickened because equipment was cleaned by contaminated water.
The bacteria is put into the deep tissue. That's an incubation place for it.
Randy Hood says patients as far back as 2011 fell ill from non-tuberculous microbacteria following plastic surgery. Most of the roughly 24 patients were cancer patients getting breast implants.
The first infection or the second infection, open up an investigation.
Following the outbreak, the State Department of Health and Environmental Control, as well as the Federal Centers for Disease Control, began investigating Roper Hospital's main campus. The investigation was launched in July 2016. The health regulators identified an abnormally high level of bacteria in the water system at the hospital.
They've all been completely debilitated for a very long period of time because what happens, this isn't the type of an infection where, okay, let's go take a Z-Pack.
8 months after the health regulators launched the investigation and recommended changes, patients from Roper downtown continued to get sick. A spokesman for the hospital says the hospital found no proof patients became infected at Roper. Since the outbreak, he says the hospital made changes DHEC and the CDC recommended. Though roughly 24 people were identified already, attorneys believe it's likely more contracted illnesses and will come forward now that the water system issue has come to light.
Roper refused to answer my questions about the outbreak, but I